episode of the Family Hour. Adrian Austin Mukalazi is my name. And of course, every Tuesday, we talk health here. And of course, we are continuing with our norm. We are back to talk about another very intriguing topic here today. Remember, we are continuing with our series of self-care. Remember also this program is brought to you by the Child Investment Fund together with Makerere University and the Ministry of Health. And today we are talking about self-care in sickle cell disease. Of course, our team is here. Close to me is Dr. Ssali Hassan, who works at the Sickle Cell Clinic, that is in Mulago National Referral Hospital. Doctor, it's a pleasure having you this evening with us.
It's a pleasure having you also and talking to the listeners.
Yeah. We are delighted and excited to hear from you. And of course, we also have Henry Kisembo, who is the CEO and founder of AMAF Initiative Africa. Henry, it's a pleasure having you as well.
Yeah, it's a pleasure being here.
Good evening.
Good evening to you.
Yeah. So the team is here, and the rest of the time we are here, we shall be talking about sickle cell disease self-care in sickle cell disease. So we want to understand how we can incorporate self-care in sickle cells. But of course, there are things we need to know here before we continue. For example, Henry, we need to understand what AMAF Initiative Africa is, or what you do, and a little detail about the organization so that our viewer can find peace in listening, especially each time we refer to AMAF Initiative.
Yeah. Thank you so much, Kalazi, dear listeners outside there. Yes, as they have already told you, my name is Henry Kisembo. I'm the CEO of AMAF Initiative Africa. Yes, AMAF Initiative Africa stands for Ambitious Mission for Action to Promote Health in Africa. And we are here in Uganda trying to ensure that we curb sickle cell disease burden. As we understand that sickle cell disease is having one of the highest burden here in the country, and AMAF Initiative Africa is on ground doing awareness creation, doing screening for sickle cell disease in communities across the country, but also working together with the Ministry of Health to do sickle cell disease management through Ministry of Health structures like hospitals, national and regional referral hospitals on ground.
Okay, that's interesting. So, what are some of the areas you operate in? Probably one viewer might be one of the people who might be the next beneficiaries of some of these initiatives that you have in the communities.
Thanks so much, Kalazi, for this. First of all, we need to understand that our operations are more in areas that are affected or more burdened by sickle cell disease. As we understand that every year here in Uganda, 20 to 25,000 babies are born with sickle cell disease, and we understand that unfortunately that 80% of these babies, they don't make it to their 50th birthday. This means we lose these babies and they don't reach 5 years. So when we are trying to put up our implementations on the ground to curb this burden, we consider areas that are most affected by this sickle cell disease. And we understand that in Uganda, we have areas that are highly burdened, which are at approximated at 25% of the sickle cell trait. That is the northern Uganda and eastern Uganda. But also, we also have some high burden in some areas of western Uganda, in areas of Bundibujo, Kasese, and Fort Potro. So those are the key areas we are working in. In northern, we're having Oyamo district, then Butewo district in eastern Uganda. So that is where we are focusing to ensure that we reduce this burden.
Where Uganda held the self-care day from in Butewo district.
Yeah, of course. We recently had it in Butewo.
Yes. Well, thank you so much for that. Dr. Hassan.
Yes,
you know both names start with H. So,
so it's a coincidence.
So Dr. Hassan, we want to get to the understanding of sickle cell and sickle cell disease. We want to really get to understanding the science and how it affects the body.
Well, thank you very much. In simple terms, sickle cell disease is whereby we have, it's kind of a blood disease whereby a pigment called hemoglobin gets affected by mutations, whereby some of its components get affected by mutations. When I say mutations, it means a certain part of that pigment gets changed and they put in another part. I can give a simple example. If you have a pipe of water, you cut off one piece, then you replace that piece with a piece of wood. So you'll have changed, you'll have two different parts. So that means water will not flow because you've switched one part with another different part. So basically in simple terms, that's what happens. So when we talk of sickle cell disease, it's a broader term. That means if a person is affected by sickle cell disease, it means your red blood cells, because the other pigment called hemoglobin has had certain mutations. So that means the shape of the red blood cells will change from the normal one that we know. The normal shape of the red blood cells is called biconcave. You can take an example of a donut. When you look at a donut, the way it appears, that is how a red blood cell looks like.
That round shape.
Yes, but the only difference is in the middle with the donut we have a hole. But when it comes to a red blood cells, in the middle there is a very thin layer. So that is the shape the red blood cell takes. But for the case of the sickled ones, they will take a C shape instead of that biconcave spherical shape. So they will take a C shape.
As in letter C.
Letter C. The way you know this equipment called a sickle, the one that is used in agriculture. Yes. So that is the shape that those red blood cells will take. So a person who is said to be having sickle cell disease, that means you have a good number of your red blood cells taking that shape. For a child who is said to be having sickle cell anemia, that child will have the greatest percentage of the red blood cells having a sickle shape. So basically, that is what sickle cell disease means.
So what is the difference between sickle cell disease and sickle cell anemia?
Sickle cell disease and sickle cell anemia are basically the same terms. Sickle cell disease is bigger, but because sickle cell anemia is commoner, so we tend to take sickle cell disease as the same as sickle cell anemia. There are several other kind of mutations that take place. One of them, we may have sickle cell trait, whereby you have at least one gene of your hemoglobin mutated. So if you have at least one gene, then that means you have a trait. But then if you have both genes mutated, then that means you have what is called sickle cell anemia or sickle cell disease. For you to become to have sickle cell anemia, it means you inherited one of those genes from your mother and another gene from your father. But in case you inherit only one abnormal gene from your mother or from any of your parents, and the other one is normal from another parent, then you get a trait. That means you have only one abnormal gene and the other gene is normal. So you have a trait in that case. But then if you have both abnormal, that means you have sickle cell disease or sickle cell anemia. Yes.
Now the other thing that disturbs us who are not into the medical world is how this whole science comes about. Because someone might say, maybe I might also be at risk, or maybe there are specific, these days there's a lot of science around food. So maybe someone can say, maybe if I eat this particular food, then it can affect my genes.
Basically, no. That is not how it works. There are several mutations that take place. If I say mutations, people may not understand. But just get to know that certain things didn't go well when development was taking place. When development of these blood cells was taking place, certain things didn't go well. Unfortunately, we as individuals, we have no control over that. There are several things that may take place. Then you get them mutated. So for you, you have nothing to do about that. The only issue is if both your parents have a trait. When we say trait, the simple term is carriers. That is what is common in our community. If both of them are carriers, that means they have a trait. So if they get to married, chances are high that they will give birth to you who has sickle cell disease. So for you, you have no control over that. Your parents have no control over that. The only issue is if both of them have a trait in them, then you can end up being a sickler.
Oh.
Yes.
So now, what is the difference between a sickler and a carrier? Because that is also another science that disturbs us.
When we say you are a sickler, remember we said you have red blood cells.
Yes.
So every person has normal red blood cells, which are this by concave, as we said. But now for a sickler has both the normal and the sickled cells. But the sickled are more in percentage. Let's take an example. You may have the sickled red blood cells as 90%. That means the normal ones are only 10%. So for you, you are considered a sickler. As long as the sickled are more than 50%, then you are considered to be a sickler. But if you have a lesser percentage, less than the abnormal ones are less than 50%, then for you, you are a carrier. Yes. And because you have lesser of the abnormal ones as a carrier, for you, you don't get the problems that the sicklers get. Yes, because most of those problems come from the sickled ones.
Okay, we talk about the diagnosis, so that what investigations you do to get to these conclusions that for you a sickler, for you a carrier.
The key investigation that we do is called HB electrophoresis. So HB electrophoresis helps to count how many normal cells you have and how many abnormal red blood cells you have. So it will give you a percentage. That is the key. We call it a confirmatory test. That is the one. But there are others which can give you a picture that you have a trait. We can have solubility tests that Mr. Henry has been carrying out in every part of the country to help give a picture that you're having a trait, but it's not confirming whether you're a carrier or you are a sickler. So the only confirmatory test is HB electrophoresis, which will give you a percentage. Remember, we said for you to be considered a carrier or a sickler, it will depend on how much of the sickled cells you have versus the normal ones.
Before I come to the facility for a confirmatory test, are there anything like signs and symptoms that I can look at as a layperson, and then I realize probably there could be a reason or there could be a risk of me being a sickler?
Unfortunately, because of the less kind of sensitization, of course we are doing our best to sensitize the people, but most of the people, the message has not yet reached to many. There are key signs and symptoms you can look at, but as a layperson you may not be able to know. These children, once they are born, they tend to have yellow eyes sometimes. So if you see your child is getting yellow eyes frequently, so you need to put a question mark. Of course, there are other diseases which may cause yellow eyes, but among children, the key one is sickle cell. Then there are those who you will find they get these digits swelling. The digits, they are swelling. Those ones, even the toes, you find them swollen and they are paining. So that is also another issue that may alert you. Then they tend to get bone pains. Now you wonder, a 3 years old or a 4 years old, why would he get bone pains? We know bone pains are in adults, but children with sickle cell tend to get bone pains. So those are some of the issues that may alert you. There are several others, but those at least they are the ones which are so close that you can easily note.
Okay, Henry does a lot of community sensitization, and you have just said that much as you're trying, the awareness is not yet there. So Henry, can you tell us the importance, especially of raising this awareness in communities, especially because this is at the heart of what you do. Yes. So why do you think it is really important to send out these messages out there to the community?
Thanks so much. First of all, as one of the self-care pillars, self-awareness, it is very important for each and everyone here in the country to understand that sickle cell disease is real and it affects children and even adults. So as I'm Finishing to Africa, we are trying to do whatever we can, working with partners like Ministry of Health and other partners on the ground, other sickle cell advocates, to ensure that we educate the public, to ensure that they understand what sickle cell disease is, and if they got signs like Dr. Hassan is mentioning, what they should do. So we have moved to various parts of the country, but the country is big. there is still need more sensitization and awareness creation in various parts of the country to ensure that each and everyone gets to know their status of sickle cell. Differing from other diseases like HIV, sickle cell disease, its burden will still continue unless each and everyone gets to understand their sickle cell status. Because even if you are normal, even if you're normal or you're a carrier or even a sickler, it helps us to evaluate and also know how the burden is either going to increase or reduce. If, for instance, someone tested and their status is normal, it will mean this person, if they got married to someone who is a carrier, it means they will not produce a child with sickle cell disease. But the moment, as Dr. Hassan has said, someone has tested and they have a trait, meaning they are carriers of sickle cell. If they get to marry some other partner who has also a trait, meaning they're also carriers, so the two carriers are meeting to produce a child. So we have very high chances that this child is going to have sickle cell disease. So it is important for everyone to understand how they are standing. It's important to know that you are normal. You don't have a trait, neither do you have a sickle cell disease. It's important to know that you have a trait. It's also important to know that you have sickle cell disease. As we have said, we are using solubility testing kits due to the current. Sickle cell disease has been one of the most neglected non-communicable diseases. But we are saying that it is becoming a very big burden to Africa. Because as like Dr. Hassan was saying, 70% of the world's population is having a sickle cell trait. So if we allow it to keep multiplying every time and then, it will take us all. It will take us, our children. We are going to give birth to children who are sickle cell warriors. And as long as we don't take control of this, it will get out of our hands. So that's what I'm saying. Whether you have a trait, whether you are normal, whether you have the disease, you need to understand. You need to know. That's why we're saying in self-care, self-awareness is very much key. As you know that self-care, we have 3 pillars: self-awareness, self-testing, and self-management. Okay. And we stand on those pillars to implement sickle cell programs in areas where we go. Okay. So sickle cell awareness, we are saying that everyone must know. You need to know your stand or your status of sickle cell, because it will help you or it will guide decision making when someone is going to get married. And also saying that sickle cell self-testing, we have not yet had tools that helps to an individual to test themselves. Currently, we are saying that the current diagnostic kits are either solubility testing kits or the HB electrophoresis, which is confirmatory. So we are saying that we need, or we urge the government to look at having self-testing kits, whereby someone is able to do what? To test themselves. So that we embrace this key of self-testing. But we're also saying under that very umbrella that let everyone test, because Ministry of Health has provided free testing kits. These solubility tests we are doing are free of charge. So it is incumbent to everyone to come and access the service. Because under self-awareness, you need to know how you're standing, your status. And if you've come to test, and we have said we have not yet had the diagnostic tests whereby, like in HIV, we have those kits whereby someone is able to test on their own, even without a health worker. Even in family planning, we have had these injectables, the family planning, whereby a mother is able to inject themselves without a health worker. So this is still lacking in sickle cell disease, whereby we have not yet reached that milestone, whereby we have the screening kits, whereby an individual is able to take a test on their own. So we urge the government and self-care to at least put resources, and we have those self-testing kits, and we embrace that pillar. Then, of course, I think Dr. Hassan also talk about self-management. Sickle cell disease, 70% of the management for sickle cell disease is done at community level. It is home-based. Dr. Hassan will throw more light on that.
Okay. Thank you so much. At this point, we are taking a short commercial break. When we return, we are going to continue with quite a lot more that you need to know, especially with self-care and sickle cell. Welcome back from the break. We are continuing with our talk on self-care and sickle cell disease. Edwin Austin Mukalazi is my name, and of course with us is Dr. Hassan Ssali from Mulago National Referral Hospital, and we also have Henry Kisembo from AMAF Initiative Africa. Doctor, before the break, he was referring to something, and that is management, especially at community level. But let us start from when you have diagnosed someone and they have done the confirmatory test, and so you can, I mean, you have proved that they have a sickle cell disease. What happens next? Because now this is where some parents now start looking at themselves as being cursed, bewitched. I mean, so someone will remember an aunt she didn't give a gomesi on the introduction.
and sarcastically, just like you say, those are the kind of complaints we get from our clients. It takes a lot to convince someone that you have sickle cell disease in your family. Most of them will even bet that I've never seen this. They even go ahead to consult their grandies who will also say we've never seen this. But if they don't sit down to come and be taught, they will continue complaining that this time the experts have given a misdiagnosis. So actually, management starts with educating the couple. That's if they have given us a chance. Most of them don't come as a couple. You'll find it's only the mother who will come with the baby. So we try to educate the mother, and men usually don't come. So management starts at educating the mother what sickle cell disease is, how it comes about, what they are supposed to do before we embark on our own treatment. Because if you happen to give the medications, because basically what we give is medication on top of what they do at home as part of self-care. So before you give them the medication, you have to show them why they need to take these medications. What is the importance of each of these medications? Because there are several of them, and each of them is given at a certain stage. So after teaching them, now we get to do further tests of the blood. We do what is called a CBC to indicate how much blood do they have, which other problems do they have within their blood, because these sicklers tend to be prone to infections, several infections. So we look into their blood to see, do they have any infections? If in case they have them, we manage them. Their blood level, just like we said earlier, those sickle cells are very, very fragile. They can easily break, and as they break, that means a child will be suffering from anemia. Their blood level will always be low. So management may also involve transfusing in case the blood level is low to that extent that a transfusion is required. But in case it's not, we are supposed to give them some tablets which are supposed to boost their blood production so that it can be elevated in amount. We are supposed to give them drugs that are supposed to be managing or to prevent infections, because they are so much prone to infections. So we tend to give them those medications. Then there are other disease-modifying medications that we give to them, which help to lower the risks of these sickle cells, the risks that they are supposed to get, the complications that they get. There are those medications. Many people now know it. It's called hydroxyurea. So we give them. But before we give those medications, we are supposed to do several blood tests. We are supposed to look at the liver. Is it functioning well? Is the kidney functioning well before we give that medication? But these others, the folic acid to boost the blood level, the monthly fansida to help like reduce the risks of malaria. So those ones we give them without doing these other tests. Then there is a PenV also. There are several others. So those are the drugs that we are supposed to give them, which they are supposed to take whether they are sick or not sick. They are supposed to take them every day. They are supposed to take them every day. These others come with complications that they may have suffered. In case they get a crisis, someone is in pain, then we are supposed to give painkillers. Now, on top of those medications that we give to them, there are several other forms of management that we train them to give to their children. We encourage them to give them a lot of drinks. A lot of drinks. We encourage them to give homemade drinks, homemade juices, water, ORS, Dalos, what is commonly known as daros. So we encourage them to give them. We don't encourage them to buy factory made juices because they will not sustain. They may not sustain it, but homemade juices, passion fruit, passion juice, water, and so on, we encourage them to give them their children. That is part of management. We encourage them to ensure that these children eat a balanced diet, which, because sickle cell is associated with stunting of growth. Many of sicklers don't grow at the same rate as their counterparts who are not sicklers. So we encourage them to give a balanced diet to ensure that at least they boost their what? Their growth rate. Their health is boosted. We encourage them to keep these children warm, because if they are not kept warm, that means they are predisposed to crisis. Whenever these children get a crisis, there is always a trigger. It may be dehydration because they are not drinking well. It may be because of extremes of weather. Extreme coldness can trigger these crises. So we encourage them to keep these children warm. If you don't keep them warm, then a crisis will come. We also encourage them to avoid strenuous activities. Of course, they are supposed to engage in co-cultural activities, engage with their counterparts, they play around, but their physical activities have to be regulated, because if you don't regulate them, any form of serious stress can predispose to crisis. So in kind of management, all those are looked into. So of course we do our part as health workers, but then we also encourage these parents to play their part in form of self-care. So by giving them enough drinks, by preventing them from getting so much cold, by giving them a balanced diet, and also encouraging them to take these medications. Imagine a child of 3 years taking medications every day, and not one medicine, not two, not three, you get. So if you don't really do what is necessary, they may not take this medication. Yes.
Well, thank you so much, Doctor. This afternoon, I was at Uganda Allied Health Sciences Institute, formerly paramedical, Mulago paramedical, and then I had an argument with someone, and he told me the simple definition of self-care is have money in the pocket. But we really want to I mean, Henry, help us understand self-care, and then we shall look at how we can incorporate self-care in the management of sickle cell.
Thank you so much. I'm really amused by that kind of definition. Have money in the pocket.
Yes.
So what I would like to tell Ugandans is that what we've just talked about here, what Dr. Hassan has mentioned, what I've mentioned previously, I talked about self-awareness. I talked about self-testing. Dr. has talked about self-management. However, in his management, he talked about self-management, but also management assisted by healthcare professionals. So whatever we've talked about, that is self-care. However, like any other expert in self-care, I would define self-care as the ability of an individual, families, and community to protect or to promote health, prevent diseases, and also maintain their health. But also, without forgetting that there are those who are already affected by illnesses and disabilities. So the ability to promote, prevent, maintain, but also cope up with the disabilities and illnesses, with or without a health work, is what you call self-care. There is no definition of self-care that goes beyond that. So self-care is a broad animal that we need to embrace. I would like to also mention that in 2019, World Health Organization launched the self-care guidelines, which later in 2022 they were able to expand because other health areas were being added so that a number of health issues are tackled. So as Uganda, I want to thank the Ministry of Health that they took it up. Uganda was among the first countries to uptake and embrace self-care guidelines. So that whereby in 2024, in October, Uganda launched its own guidelines in self-care. And as I was mentioning, on 31st of last month, we're in Butebo, and Ministry of Health was able to give these guidelines to the custodians, the stakeholders, the DHOs. So we are calling upon each and every stakeholder to embrace these guidelines. And we are saying that these guidelines are not only talking about sickle cell disease, but also other areas. For instance, these guidelines are aligned to ensure that we have universal health coverage goals here in the country. That is how, while those guidelines were being formulated, they are aligned to that. And we see that in those guidelines, we are going to see antenatal care being mentioned, where we are saying that a mother is supposed to attend all antenatal routine antenatal checkups. So it is self-care for a pregnant mother to go and do checkups at the health facility and get to understand how the fetus is growing, but also understanding their status. So also we see family planning coming into play. We are saying that we are reaching a standard whereby a client or a recipient of a family planning is going to be able to use to administer a family planning on their own. We have seen it in areas where self-care guidelines were operationalized or where the piloting was done in Mukono district. Recently, WHO organized a high-level national dialogue on operationalization of self-care guidelines. We received a number of testimonies from VHTs, from health workers on how self-care has improved or has eased access to healthcare services in Mukono district. So we are saying that if we embrace self-care, we are going to see a reduction in hospitalization of patients. We are going to decongest. Recently, the Director General of Health Services, Minister of Health, while we are commemorating the National Self-Care Day in Butebo on 31st, he mentioned that we are going to see decongestion of hospitals if self-care interventions are welcomed or embraced, because we are looking at scaling down these self-care practices to the lower facilities and also at community level. This will of course decongest the health facilities. People will no longer be going to the hospitals to check their blood pressure. They will not be going to health facilities to check their sugar levels. Yes, someone or a person should be able to test themselves whether they have high blood sugar levels or high blood pressure. Someone should be able to test on their own whether they have HIV or not. So this is something we are trying to see how this can be done in sickle cell disease. We are saying that sickle cell disease burden is increasing at a very high rate. So through self-care, how do we have self-testing kits to ensure that everyone on ground is able to know their status by testing themselves? But also we are calling stakeholders to finance awareness creation, because that is where it starts from. As long as the communities, the families and other members are not aware of their sickle cell status, we are seeing the burden increasing. So we call upon the government and other implementing partners to come up and give a priority to sickle cell disease, and we align it in these self-care guidelines to ensure that we operationalize them together, and we shall see a reduction in sickle cell disease burden, but also less burdening the hospitals, because already people will be able to do testing on their own. They will receive information from knowledgeable experts and do as advised, but also we shall see self-management, because we are saying that most of the non-communicable diseases like high blood pressure they are also being among the other causal risk factors, a lack of exercises. We're having people sitting in their offices 1 week, 1 month, and the year ends without them exercising. In the evening at 5, they are getting their vehicles and they're going. So we are saying that self-care is broad. Let's do exercises. Let's team up and exercise at work. Let's do exercise everywhere so that we can combat these non-communicable diseases. That's the highlight I could give. But we're also saying that among other areas that are looked at are the postnatal care, whereby we are saying that these guidelines, when I think the stakeholders should take interest in looking at the guidelines. If you don't have the self-care guidelines, kindly take an initiative to find out and see how they can be implemented, and they will support us fight the NCDs and other diseases that are in that line. Thank you.
Thank you so much, Henry. Actually, Dr. Hassan, as you come in to tell us how patients are living with sickle cells can practice self-care, there's also someone here raising a concern. Where can they get, I think, just to wrap it up because it's a very long text, but they're wondering whether it is possible to get to a facility where they can get these medicines at a free cost, because the complaint here is that in most, and as I highlighted some facilities where maybe they have gone, that in some facilities there is no medicine, so they have to buy the medicine, which is expensive, and yet they're supposed to use it every day. So is there a facility where they can get this medicine readily available, probably, so that they can change? But also to tell us about self-care and how sickle cell disease patients can practice self-care.
Okay, thank you very much. Let me start with the issue of the medication. These medications are free of charge in all government institutions, as long as the government institution has a sickle cell clinic. There are certain levels of health facilities which are supposed to have a sickle cell clinic, like regional referral hospitals, some of the district hospitals, national referral hospitals. At Mulago, we have a very active clinic that works Monday to Friday. So you can get those medications throughout the week. Unfortunately, like the government system, there is what is called essential medicines. So those ones are always stocked in plenty. But then these others are not always in plenty. So there are seasons where you'll come and find that these medications are there. Then other seasons you find that the medications are out of stock. So we just call upon our government to come up with a plan that will ensure that these medications are always in the hospitals, because they are really expensive. I can give an example of hydroxyurea. A capsule of 500 milligrams costs between 1,000 and 1,500 Ugandan shillings. So imagine a child who is supposed to swallow 1,000 Ugandan shillings every day. That's if he's taking one capsule. But there are those who are taking 2 capsules every day. There are those who are taking 3 capsules every day. So a layman may not be able to afford. So we are just calling upon the government to find measures of at least stocking these medications so that they don't run out of stock. Okay. Now, when we come to the part of self-care, indeed self-care is very, very, very key, because before I get to that, I can give you the burdens of sickle cell. Sickle cell is growing at a terrible speed. Henry earlier on, he said we have a global burden of 7% population being sickle cell. Every year, to add on that, every year, 300,000 to 500,000 children are born with the sickle cells world over. When it comes to Africa, Africa alone contributes 80% of sickle cell disease. 80%. And of that 80%, most of them are in Uganda, Tanzania, DR Congo, and Nigeria. Uganda in Africa ranks number 4. The first one is Nigeria, the second one is DR Congo, and the third one is Tanzania. Then Uganda ranks number 4 at the rate, when we look at the rate at which sickle cell disease is growing. So that means if we don't practice self-care, these numbers are going to keep growing. In Uganda alone, every year 20 to 20,000 children are born with the sickle cell every year. So self-care is very key. What do I mean in this case? Let it be a duty upon all cultural leaders to encourage people to test for sickle cell disease. So that is part of self-care at a community level. Religious leaders get involved. That is part of self-care. To those who have not yet gotten the disease, discourage couples who are carriers to get married, because as they get married, that means we shall have more and more children born with sickle cell disease. So, and to those who already have the disease, the self-care that they can practice is taking the medications as prescribed by the health workers. Because we health workers, we wait for you in the clinics, you come, we tell you take 1 hydroxyurea every day, take folic acid every day, take Fancida every month, take Penv if you are at that stage of taking Penv. But because parents are fond of sympathizing with their children, they will be like, at least today let my child rest. Just get to know you are breaking the chain of health care, of self-care, in case you tend not to encourage your child to take what? The medication. And to the children, especially those who are in adolescent stage, they tend to want to compare themselves with their peers. He sees he's having probably a bigger physique, a better physique than the colleague. But the colleague is not taking medication. So it will be like, me who is more healthy, why should I keep taking medication? So they end up not taking them as expected. As long as you're a sickler and you're not taking this medication, get to know you are breaking the chains of self-care. You're supposed to hydrate every day. You're supposed to drink, on average, a child who is an adolescent should take 3 liters of fluids. You drink up to 3 liters. So as long as you're drinking less than that, get to know you are not taking self-care as serious as expected. You get. Eat a balanced diet. When I say a balanced diet, we don't expect you to be looking for meat, chicken, those kind of things. Just make sure you have a protein, you have a carbohydrate, you have a vitamin, those kind of things. You need them from the usual meals that we have at schools. Those ones who are in boarding sections. Beans have enough proteins that we need. Posho has enough carbohydrates that we need. The day you say you will not go to eat beans and posho, get to know you are breaking the chains of healthcare. Children have a tendency of wanting to buy a chapati, they want to buy noodles and replace those for meals. Get to know you're not practicing self-care because you're not taking a balanced diet. Noodles, or there are these snacks that children tend to take, kick snacks. They don't have the ingredients that we need, the nutrients that we need. So as long as you're not taking what is expected of you, you're breaking the chains of self-care. So basically that is what they are supposed to do. Yes.
Doctor, in a minute, give us your closing remarks as we wind up this discussion.
To close this discussion, I'm calling upon every leader at any level, be it at a family level. For you as a father, your responsibility to ensure that sickle cell disease does not grow. Make sure that all your children know their status. Once they know the status, encourage them, if they are carriers, not to marry carriers. Now, for the case of religious leaders, these couples come to you before they get married. The question that has always been asked, have you had an HIV test? And has it been negative? That is the question that is asked. Make sure on top of that question, you'll also ask, do you know your sickle cell status? So that is the closing remark that I'm giving.
Thank you so much, Dr. Hassan. Henry, your closing remark.
Thank you so much. Of course, I want to call upon everyone and inform them that self-care starts with you. There is no one who is going to come and care for you unless you care for your own. Yeah, self-care is is something that starts with at individual level and individual basis. So each of us is entitled to care for themselves before someone comes to care for us. So one, individuals, please, let's ensure that we practice self-care initiatives to ensure that our health, both mentally, spiritually, and physical, is kept in situ or at par. Second, I also want to ask the government to look at increasing the budget for sickle cell disease. Because whereas we are saying that self-care, we are having self-management, and we are saying that patients should adhere to their treatment, but we are saying that we have some stockouts of hydroxyurea, and maybe if the government increased the budget for sickle cell disease programs, we could have drugs like hydroxyurea procured and increased in national referral hospitals, regional referrals, even at district referral hospitals, but also increasing awareness programs, campaigns everywhere in the country. It would also reduce the burden of sickle cell disease spread. Also, there are some policies that I think if the government implemented them would really call to an end to sickle cell disease, like mandatory premarital testing and counseling. Let every person who gets married be tested for sickle cell disease like any other disease like HIV. Okay. I think with that, we can practice self-care and we shall be good for good in my country.
Thank you so much, Henry. Thank you so much, Dr. Hassan. And to your viewer, thank you so much, you who started with us. Special thanks to the Ministry of Health in partnership with Makerere University and Child Investment Fund. Thank you so much for being part of the awareness campaign, especially with self-care. Adrian Austin Mukalazi is my name. I've worked with Jonah Jal, I've worked with Mohomuza, and from the entire team, we wish you a blessed night.